check this out. These little white things you see can actually help your husband stop snoring. And they also help people who wake up in the middle of the night because of sleep apnea, which is a very serious situation. The procedure is called 3-pillar procedure, and it's topping today's Medical Monday segment.
Doctor, give me the news. I got a bad case.
And Dr. Anthony Sertish is here to tell us why we can get this procedure now here in San Antonio. We could never get it before. You're the only doctor.
That's right, Leslie. Thanks for having me.
And I live with a snorer, and it's hard on the person who's trying to get sleep next to the snorer, but it's also hard on the person who is snoring if it's caused by sleep apnea, right?
Exactly, exactly. The sleep apnea is where people, many times a night, their airway collapses and they completely lose the ability to have oxygen get to their brain or their heart.
So they wake up.
Exactly.
Right, many times throughout the night.
Exactly. You don't become conscious, but you're brought up from REM sleep where your dream state should occur. It creates even metabolic problems.
But there is now a procedure that will change that. It's called the 3-pillar procedure. And I understand it's less invasive than other procedures.
Absolutely. It's something that we do in the office, in the medical office, under local anesthetic. Most patients have a sore throat that evening, and the following day are ready to go back to work.
And also it's completed in a very short, just one office visit situation.
Exactly. Even in a few minutes.
And what about sedation? Just local?
Exactly. We spray some spray to numb the throat, and a lot of times it's even less than going to the dentist.
And this is approved by the FDA?
It is FDA approved since 2003 for mild to moderate obstructive sleep apnea and snoring.
Okay, let's go ahead and take a look at some of the video right now and a procedure. And what is going on at this point?
Well, what we're doing is we're getting ready to use the inserter. We're taking off a portion of the applier, and we're getting ready to put this in the patient's throat. We're looking at the area between the hard and soft roof of the mouth, and we're going to implant this and in the midline, and then subsequently about 2 millimeters on each side. These little 3/4-inch Dacron implants are the same materials that have been used for over 50 years for vascular surgery to repair large blood vessels. And so it's a quick and easy procedure, and the patient really does well.
And we see that this is being done on a woman, so it can be for a woman or for a man. Who is the best patient for this? Who needs this?
Well, the best patient is the person that has at least a 2.5-inch palate and doesn't have large tonsils or large back of the tongue. People that are very heavy or have severe obstructive sleep apnea may not be the best candidates for this technology, but folks that have mild to moderate obstructive sleep apnea and snoring are excellent candidates.
And do those tubes stay in there permanently?
Those little Dacron inserts stay there and become fibrosed. There's a little area that grows around them, and they only rarely extrude. That's about the only downside to this. And if they do, we just take them out. If they've been there long enough, we don't even need to replace them.
And is this something that the patient can tell, almost have that feeling that they've got something in their throat, or does it become like second nature?
No, it's because it's put into the muscle of the palate, the patient doesn't feel that they're there. Sometimes the first evening they may feel a little foreign body sensation, but usually the next day it's the little area is healed and they don't even notice that it's there.
And how young of a patient can you put this
Typically
into?
it's somebody that's above 18 years of age. We want the palate to be fully developed and not have to worry about any consequences of inhibiting the growth of the palate. We haven't seen any downsides of problems with people being able to enunciate, use their voice, or swallow. And so we've come a long way to treat mild or moderate obstructive sleep apnea instead of doing very invasive procedures.